So my name is Dr. Frank Serebour, the president of the Ghana Medical Association. I also work in Bekwai Municipal Hospital, which is in Ashanti region. I'm the medical superintendent of the hospital, a very beautiful hospital indeed. So that is my little background. But I'm a pediatrician. So AI integration into our healthcare systems is something that we cannot do without. At this moment, whether we like it or not, that is where the world is heading towards. And so if you look at our health space in Ghana, we are always talking about the fact that we have issues with brain drain. We have issues with doctors not being available in certain places. We have issues with some facilities, equipment not being in certain places and so forth. So AI for me is something that will come in to bridge those gaps, such that regardless of wherever every Ghanaian or find him or herself, a person can leverage on AI and be able to get the kind of quality, accessible healthcare that he or she needs. So in terms of accessibility, this is what is so key. So that regardless of where you are, you can have your specialists or consultants be in another place and you can still have access to that individual. In the same space, if we have AI, it would help us in terms of even our investigations and even delivery of medicines. So it's something that I believe is so important and crucial in our current dispensation as far as health is concerned. So one of the key challenges is first and foremost the issue of looking at how the kind of laws that govern the implementation of AIs. So we don't have policies. So it's important that policies are developed. And once we develop those policies, it's so important we make it accessible, or they should be available. The infrastructure for AI should be available. Currently, we don't have it readily available. And then even internet services is not everywhere. And where they are even expensive. And so we need to work on those aspects. And our data protection should also be very key in this area. So I think these are the challenges that we have. But apart from that, the technology itself in certain places is lacking. So we need to ensure that we also get those technologies here within country so that it can support us to ensure that at least we move forward. So basically for me, those are the challenges that we face. Yeah. So for essentially AI cuts across, because if you have virtually there is no disease that AI cannot touch. Even in the field of surgery, even though you may need a physical theater, we can leverage on AI to have very good outcomes in terms of our surgical outcomes, being the incisions and the precision, avoiding unnecessary damage to other tissues that are not affected and so forth. We can leverage on technology. And so everywhere, you cannot say, even in tracking diseases that outbreaks, we can't say AI is important. So I don't see the hypertension, the diabetes, the malarias that we have. You can probably even go to a booth wherever you are in your village. You just go, you test this with an AI tool. The results are sent to a clinic. The clinic prescribes, and then the pharmacy delivers the medicine to your house. So I think that AI is not limited into particular diseases. I think it's a wide range of diseases that it can be used to support. Currently, I doubt if there is any health professional who doesn't use a mobile phone. All of us are using mobile phones. We are using the various interactive applications, including your WhatsApp, your Telegram, your whatever. And people are using WhatsApp for even consultation. You'll be somewhere and somebody texts you a picture asking you for support and so forth. That person may not know that she or he is using AI, but that is AI for you. So let's understand that it's become part of us. We should embrace it and we'll make the good use out of it and ensure that it benefits all of us.